Well, this is the right time to look at the liver, the largest organ we have in our abdominal cavity. The transverse diameter of the liver may be as high as 20-26 centimeters, while the axial diameter on the coronal views may be up to 15 centimeters. As well as spleen, liver has absolutely smooth, convex diaphragmatic surface, which is in very close contact with the diaphragm, as you see here. And it has a concave visceral surface, which includes the porta hepatis and several ligaments. By the way, this line, grayish line here, dark line, it represents ligamentum venosum, which subdivides the left lobe of the liver from the right lobe of the liver. And of course, the portal vein, it shows us where the porta hepatis is located. The falciform ligament is closer to the anterior wall of the abdominal cavity, and it is much better visible in the patients with excessive fluid in the abdominal cavity. Normally, as you see, liver has very close contact to the diaphragm and to the organs around. The kidney is located just behind here, and this grayish oval-shaped organ which approaches liver from below is our gallbladder. It is hypointense because it has some fluids and bile inside. That's why we easily can differentiate it on the images. And now compare the liver you have just seen with this one taken from a patient with the acids as a result of cirrhosis and portal hypertension. You can see the excessive fluid in the abdominal cavity, all these grayish tissues around the liver. They indicate the accumulation of the excessive fluid. You can see clearly the falciform ligament running from the liver to the anterior abdominal wall. Here it is. And the falciform ligament subdivides the subdiaphragmatic space, or subphrenic space, how it is also called, into two, the right and left. To understand better where the subphrenic and subhepatic spaces are located, let's look at the abdominal cavity at the coronal view. And now all these grayish tissues around, they represent the acid fluid. The falciform ligament appears in front, and we have a large space above the liver, which is our subdiaphragmatic space, and we also have some space under the liver, and this space is called the subhepatic space. The deepest part of the subhepatic space, it runs posteriorly and is visible on this image here. Under the liver, between the liver and kidney, we have so-called hepatorenal recess, which is also known as Morrison's pouch. You can see how Morrison's pouch and right subhepatic space continues with the right paracolic gutter running all the way down and connecting the pelvic cavity with the subdiaphragmatic space. This is the route which infection and fluids may take, spreading up and down through the abdominal and pelvic cavities. And on the opposite side of this image you can see the second one, the left paracolic gutter, running all the way down along the lateral side of the abdomen. And you even can see this phrenicocolic ligament. The phrenicocolic ligament closes the left colic gutter, preventing the spread of infection on the left side and preventing the spread of fluids and blood, whatever we have inside of the abdominal cavity, up and down. So the right paracolic gutter is open, while the left one is closed. In the upper part of the image here, between the stomach and spleen, we have splenic recess, which continues with the omental bursa. All this grayish space behind and below the stomach is the omental bursa. The omental bursa or lesser sac is the cavity in the abdomen formed by the lesser and greater omentum. It is the space which occupies the area behind the stomach from the liver on the right side till the spleen on the left side, and is closed and separated from the greater sac, from the peritoneal cavity proper, by the greater omentum and the gastrocolic ligament, which we have between the stomach and the transverse mesocolon. The only inlet to the omental bursa is the epiploic foramen, which we have right here in this area between the porta hepatis anteriorly, the duodenum inferiorly, the liver with gallbladder superiorly, and the inferior vena cava coated by peritoneum posteriorly. Well, it's probably better to look at the omental bursa on the axial view. Let's scroll down and try to find it. So we see the stomach and the spleen just behind. So now you see this wide grayish area behind the stomach, between the stomach, liver, and the spleen. And this is the omental bursa itself. So all this grayish space here is the omental bursa. If any perforation or bleed occurs at the posterior wall of the stomach, the fluid may accumulate in the lesser sac with very vague clinical picture, and it's quite difficult to diagnose it. So the area is clinically important.